Let me explain you people today about the common problem which we are facing in the Middle East and in the Asian countries. It's called Polycystic Ovary Syndrome or PCO. It is more common in Asians in comparison to Africans or the European people. Now what is the reason of PCO or why it is more common in the Asian community? There are two factors. One is genetic factors, it runs in families, and second one is obesity. It is also associated with the Polycystic Ovary Syndrome. How it happens? What is the reason? The reason is hormonal imbalance. It is related to insulin resistance and LH may be high. So what does the patient have? If she have a PCO, what is the reason? What she will face? What all signs and symptoms she will have? The patient may have irregular cycles. In 3 to 4 months she may have just one period, and there is growth of hairs on her face, on her chest, on her back, thigh, abdomen. Second thing, there may be increase in the weight, she may gain the weight, and that is the reason of the hormonal imbalance due to which she developed PCO. What are the findings? What in ultrasound I will find? The findings will be that the ovaries become polycystic. They develop multiple cysts in both the ovaries, which are called polycystic ovaries. These ovaries are non-functional, they will not produce the egg. The cycle will be anovulatory. So the PCO causes infertility in a married woman. She will not be able to conceive because of lack of ovulation. So how are we going to treat this problem? Number 1 is weight reduction, and number 2 is ovulation induction medication are available. Very good medicines for induction of ovulation are available for the PCO patients, which can be given and follow up by the ultrasound, the production of the egg, and ultimately leading to conception. What are the results? The results of the medication are very good. 80 to 90% of patients will conceive after ovulation induction. Another PCO problem is like it can cause diabetes mellitus type 2 in later life and hypertension or increase in the blood pressure in the later life. So the people with PCO, they are always at risk of developing diabetes mellitus and the hypertension. For future problems, we can do glucose tolerance test, or we can check the blood sugar of the patient on yearly basis, so that we can catch the problem before she develops diabetes, and lifestyle modification like losing of weight, control of the diet, stopping carbohydrate, increasing the protein in the diet, we can deal with these problems so she doesn't develop these medical disorders in her later life. Whenever you feel some signs and symptoms of polycystic ovaries, which I explained you can always consult a doctor, as it is a treatable condition with very good results.